tabletop. This is considered tabletop. And we don't need this sponge here because we want to do it cleanly right on the table. There's no need for the sponge, okay? So let's go ahead and move this to the side. All right, so again, we want to be at table height. So this is, this distance is in the bucky. This distance is tabletop, right? So we want to make sure we're on tabletop distance, so 40 inches. There's 40 inches, okay? If you want to center, that's fine. It's okay, but sometimes we don't center it. But since we have a free-floating table, it doesn't matter. So, you know, if we want to detent, that's fine. We can detent it. I don't care. Okay. All right. And then we have our chair here, just in case for a patient to sit. But we're going to be doing the first digit. So the first digit, I don't like to have. Well, you can have the patient sit on the chair like this, okay? And then, actually, let's have Peter, come on here. I'm going to demonstrate you.
Sit down?
Yeah, sit down. So we're going to do the first digit. So we're going to have, sir, hello, my name is Norman. We're going to take an x-ray. I see there's an x-ray for your first digit of your right hand, correct? Okay, so can you put your hand right up there, please? And what I'm going to do, I'm going to have you invert your hand just like this. And then with your other hand, I want you to grab your fingers like this and put your thumb in a position just like that. See that? Now I'm in the AP projection here. Okay? So what I'm going to do, I'm going to collimate. You're going to be on YouTube, bro. Watch. You're my YouTube. So my central ray is going to be not at the IP, but on the MP joint. We call it the MIP for those who may be politically correct. And look at my collimation, just over the area. But who's got their markers with them? Let me have a marker. Anybody got a marker?
Which one do you want, left or right? Oh.
So right marker. This is the right hand, correct? Now watch my marker placement. Don't put it there, okay? You want to have enough collimation where you can put your marker in the light. Not on the skin like that, but in a way where you have it next to the light. Okay? So look at his position. His first digit is flat on the cassette. I collimated to the area of clinical interest. The central ray is at the MIP. Right here, that's the MIP. This is our IP, this is our MIP. And I got my marker there, okay? So that is your AP, first digit, right? That's your AP. So there's no breathing, just say hold still, don't move. If you move, I'll hit you in the head, all right? And then we should expose, and there's our first two. One, area of clinical interest, which is the thumb. So that's where our collimation falls under, right?
And we don't need to shield in this one, right?
Of course we do.
Oh,
I'm just showing you, we haven't gone through the process.
I know, yeah.
Of course you're going to shield the patient on the waist, right? Okay, so that is AP. So we're going to go oblique. So go ahead and relax, sir. And what I want you to do, you're going to put your thumb right here, and I want you to kind of like lay your hand kind of flat like that. And then you notice that I'm not even trying to move. I'm moving the cassette. So that way it's still, what? Centered, right? In a way. So, what about my life, Mr. Roland? This is crazy. Well, guess what? I can do this. There, okay, I hear, guys. Ooh. Ah.
I've been waiting for that thing to turn,
Yeah.
actually.
There's my oblique. I got to get my proximal, according to the book, I got to get my phalanges and part of my interphalangeal, metacarpal, and carpal bone. I have to get part of that. That's part of the criteria, the evaluation criteria for an oblique thumb, first digit. I have to get the carpals, the phalanges, the dip, the IP, the MP joint, part of the metacarpal, and part of the carpal bone. So that's part of the criteria for a first digit, right? So there is my oblique. So I changed film, right? And then position. How'd you know to do that? You're my patient.
I'm sorry.
What the hell, man? Okay. So you're gonna bring your hands like this, and there's my lateral. I didn't have to move this hand at all. Here's my lateral view, just like that. Now, in most cases, when you guys are in DR, CR world, you're gonna do one film at a time. But back in the day when I was shooting X-rays, we'd do this. So AP, hold that with the other hand. Here's AP, boom. I would go like this. And here's my AP. Next one. Here's my oblique. Next one. Here's my lateral. So I did three shots in one cassette. That's how I would do it back in the days. But nowadays, you just do one cassette at a time. But if you want to be Superman like me, or like Mr. Griswold, if you want to try doing 3-on-1, that's fine. You can do that. So if you guys practice hard enough and say, when you guys want to comp, we'll tell you, is it going to be individual cassettes or in one cassette? You say, shit, Mr. Ron, I want to do one cassette. Boom, 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 boom. You show us. And then you do it right, and then we pass you. Right? But there's a way of doing it. Not just because you have to make sure you column it right, and you make sure you're overlapping one another. That would cause what? What's that? Double exposure, right? That was part of your film critique, right? So you have to make sure you're not double exposing over the area that you're shooting.
So does the marker have to be in each one since it's on one cassette, or you just do the marker one time?
One time. Yeah, if you're doing a run, we call this a run. We call this a run. And as soon as you put your marker on the first run, you don't have to put the markers on anything else. But if you're doing individual runs, of course you have to put your marker on each individual shot. So like a lot of people, when I taught last year, they like to do runs because they don't want to put the markers there all the time or change the cassette all the time because they want to do it all on one cassette. Right? Okay. So that is the first digit. Second digit, let's put your hand there. So he has an injury to the second digit. We got him here in the center cassette. We moved in multi-directional. We're still at 40 inches. And according to your book, where's the center ray going to be at? Does anybody know? Is it going to be on the pip, right? Or mid? Pip. Okay, so here's our pip. Collimate to area clinical interest. And we want to get part of the metacarpal phalange, right? Because you know, even though there's an injury here, we want to make sure that there's no injury going toward the metacarpal. So that's why we extend all the way there. And here's our marker. Here's our marker right here. And there's my second digit. If I want to do an oblique, go ahead and close your hand all the way in. And leave your middle finger out. Close that finger. And just lay that flat. And there's our second digit, oblique. If we want to do lateral, we want to turn the hand all the way that way. And there's our lateral view. So we went like this to that. Now we're doing the third digit. Now, according to your book, when you're doing fingers or digits, they want another finger adjacent to it, okay? Just for comparison. So it's okay to either have the second digit or the fourth digit next to the second digit that you're shooting. Does everybody understand what I'm saying? Yes. So in this case, I'm doing the third digit, right? So I'm going to have the second digit adjacent to it. That's okay, no problem. Again, I want to make sure the hand is straight. My central ray is going to be right at what, the MIP or the PIP? The PIP. There's my second digit. I got the distal end, middle, like distal, proximal, MP, and then I got part of the metacarpal phalange. And there's my second digit. So I may have you close your fingers and try to see your finger out like that. And then turn, you're going to just keep your arm straight, flat. And then just like that. Actually, you can do this. Just keep it flat. Nope. Just keep it straight up.
Straight up, I got it.
There you go, just like that. And there's our oblique. All right. And then our lateral, just keep it straight up. Don't lay it flat. Okay. In this case, he's having a hard time, so we have tape. So let's get some tape. The tape is our friend.
I think it's my ring finger.
It's your ring finger?
Yeah.
Okay. So let's do that. And then keep that. Whoops.
I'll hold the tape down.
No, you don't. Very good. Okay, then hold that. Okay. Keep your thumb down.
Is that how it works?
Here's our lateral. See, I taped in his hands. I put it over his wrist, and I pull another tape over his middle finger. He's holding it, and there's your third digit. So his fingers are out of the way. So again, tape is your friend. You need to have tape. But since we also have positioning sponges that you don't have to use for tape, and I'll show you those sponges too. So we done the lateral view. Okay. So here's a hard one, and I'm gonna pull your hair. You okay?
Yeah, that's fine.
Oh man.
Okay. All right. So fourth digit, you're gonna have your hand flat. Central ray. Here's my 4th digit right here. Here's my marker. Patient is shielded. Take a deep breath and hold it. I'm just joking. Don't move. Okay, shoot. And then we're going to do our oblique view. Keep your fingers in. Okay, that's fine. There's no way to keep your finger straight up. The tendency is always going to go down like this. So that's fine. Here's your oblique. And then our lateral view. So this is there. Grab that. And I guarantee you, you're not gonna do a lot of these in the field. Here's our lateral view. So you got to be creative with the tape. Okay. And then the 5th digit, take that out. Lay your fan flat. There's your PA, and then close your fingers. Here's your oblique, and then here's your lateral. So if you're doing a single shot, you're going to tell me, or Mr. Griswold, change your cassette, position for oblique, put the marker, shoot, change your cassette, position for lateral, put the marker, shoot. If you're doing a run, say we're doing a run, you use everything on the cassette. So if you want to learn how to do run, let me know and I'll teach you guys how to do runs. All right, so that's our 5th digit. Okay, let's do hands. So, can I get a 10 by 12? 3 view, 1st digit, 3 view, 2nd digit, on 4th, okay? All right, so on the hand, like I say, in traditional clinical, you're going to be doing single shots on CRDR. But traditionally, when me and Mr. Griswold were doing x-rays, we were doing 2 on 1. And then we finished the lateral view on 1 cassette. I got it right here, 14 by 17. No. We're not going that far back. Okay. All right. Okay. Yeah, that was your time, not my time. Okay. So we're gonna start. This is how I look at it. If I'm gonna do a right hand, I'm gonna go PA oblique here. If I'm doing a left hand, I'm gonna go PA oblique here, instead of going here to here. And I go what's closest to the hand. It's your preference, I don't care, but as long as you got it going. But to me, this is the easiest way of doing it. If you guys like easy, you ever seen that button where it says easy? Is that button? Was that easy or was that easy, right? Yeah, don't you guys like pushing the easy button? This is the easy button, right? So I'm gonna do my PA hand right here. And I wanna make sure, and then, is there a strip? So, with the hand, your central ray is going to be mid-carpal, or metacarpal phalanx, right? And you're going to open the collimation to the size of the area of clinical interest, right? Mm-hmm. You notice that I'm not doing the size of the cassette. I'm doing to the area of clinical interest, which is my hand. And I want to make sure my hand is in the collimated area, right? Mm-hmm. Now, you notice that his hands are straight like this, but doctors like to see joint spaces. They want to see the dip, they want to see the pip, and they want to see the mid. So I tell my patient just to bend your fingers just a tad. And what that does, it opens up my joint space, just like that. And that's how you can check for rheumatoid arthritis, all that stuff. So my hand is in the area, my central ray is in the metacarpal phalange, and then I always put my marker on the lateral side of the hand. See, this is the lateral side marker. I don't like to put my marker here. I like to put my marker right here on the lateral side.
Looking at 40.
Yeah, okay.
So that's how they usually check
40.
for arthritis?
Thank you. Well, no, that's one indicator to show any evidence of arthritis by bending the joints just a tad so we can see the joint space. Because you have joint space, right? Dip, pip, and P, right? Yeah. Right. So there is our PA, right? AP, PA. PA projection, right? AP position? Okay. All right, so we've done that. So we're going to lift, slide over, bring down, cover up, and I'm on my other working side. See that? Do you see that?
You want your marker?
You see that? Oh, I know. See, look, it's like release and grab. Oh, I'm sorry, that's the wrong thing to say. And down. All right. Oh, he's political. Sorry. Anyways. All right. So I'm ready for my oblique. I already did my shot on my PA, on my hand here. I covered it up. And, sir, can you just make an okay sign just like that? There is my oblique. My central ray is going to be metacarpal phalange, right? Right there. I don't need my marker because I put my marker over there. But just in case you want to be marker happy, I can put my marker here on the lateral side of the cassette. Remember, lateral side. Here's my opposite lateral side. Here's my marker right there. I have to worry about tube side because remember, we're DRCR world now. Remember? So my marker's right there. There's my oblique view. There's my 2-in-1. Okay, show my 2-in-1. Now I'm ready for my lateral view. So I please hand up for me, please. I finish it up this way. And can you make an okay sign just like that? And then turn your wrist just like that. And spread your fingers. Beautiful. You look like you've done this before. Perfect. Make sure this is lateral. Keep your hands straight. All right. Okay. I'm mid-carpal right here. Marker is going to be on the lateral view. I'm collimated to the area of clinical interest. Okay. Hold still, don't move. Expose, and I'm done. Sir, you're done. You can go ahead and relax. Your report will be given to you within 3 years. Do you have any questions?
No.
All right.
Thank
See you again. Yes.
So when you're doing hand, the CR is always at the MP joint, and then